As previously mentioned, the beta cells are involved in producing, storing, and releasing insulin. This autoimmune attack damages the beta cells, preventing them from producing or releasing insulin. Insulin is absent in type 1 diabetes mellitus, resulting in inability of our body to transport glucose inside the body tissue despite the cells being hungry for glucose. So basically, all of our body cells need glucose, as glucose is the basic food of our body cells. So insulin is responsible for moving the blood glucose from the bloodstream into the cells, especially the cells of the muscles, the brain, the lipid cells. So when insulin deficiency occurs, all of these cells go hungry and they start catabolizing. They start destroying their own proteins and their own fats. So the destruction of their own protein and their own fat cells starts to occurs because despite glucose levels being 300 milligram per deciliter or 400 milligram per deciliter in the blood of the patient, but glucose is not available for the cells of the human body despite patient having highest levels of blood glucose levels in their body. The patient's cells are hungry for glucose because insulin is not there. Insulin was responsible for moving glucose from the bloodstream to inside of the cells. So all of these problems start to occur when insulin deficiency develops in type 1 diabetes mellitus due to destruction of beta cells of pancreas. So the causes of type 1 diabetes mellitus are: type 1 diabetes mellitus is an autoimmune disease in which the insulin producing cells of the pancreas are destroyed, resulting in little to no insulin production and elevated blood glucose levels. Several possible causes of type 1 diabetes mellitus, also called IDDM or insulin dependent diabetes mellitus, are shown in the illustration. So type 1 diabetes mellitus has very diverse causes. You cannot actually control the incidence of type 1 diabetes mellitus because if it has to happen, it will happen. But it is present in only 10% of the individuals. More than 90% of the people which are suffering from diabetes mellitus are not from type 1 diabetes mellitus. They are suffering from type 2 diabetes mellitus. That is why it is preventable. It is called a preventable disease because 90% of the people are not from type 1 diabetes mellitus. They are from type 2 diabetes mellitus, which can be prevented with lifestyle modifications. So type 1 diabetes mellitus is caused by infections, autoantibodies, or genetics. So potential association between certain viruses and the development of the autoimmunity that leads to type 1 diabetes mellitus has been documented in the literature throughout the past century. So enteroviruses, Coxsackie B virus, rotavirus, cytomegalovirus. So repeated infections with any of these viruses results in the development of type 1 diabetes mellitus in such an individuals, especially at early ages. So that is why the viral infections in these individuals lead to type 1 diabetes mellitus, because these viruses mimic the insulin receptors of our body. So the autoimmune system of our body, which produces T cells against these viruses, and then starts to destroy our own beta cells of the pancreas in a confusion. And other association with autoantibodies against beta cell antigens and the development of type 1 diabetes mellitus. Beta cells are responsible for producing insulin. The autoantibodies destroy the beta cell. There are also incidences where there is no viral infection, no history of viral infection in any individual, but still there is an autoimmune destruction of the pancreatic beta cells, which were responsible for production of insulin. And when these beta cells get destroyed, then insulin deficiency occurs, and this absolute insulin deficiency causes type 1 diabetes mellitus. Then there is also a link with genetics, potential association between the presence of HLA, human leukocyte antigen proteins, DR3 and HLA DR4 genotypes, and the development of type 1 diabetes mellitus is also there. I will not go into the details of the genetics because it will go out the scope of this lecture, but these are the basic causes of type 1 diabetes mellitus, which we basically cannot stop. So if type 1 diabetes mellitus is gonna happen, it will happen. But as we already know, it is only 10% of the cases. 90% of the people suffering from diabetes are type 2 cases, which can be prevented. There are several risk factors for type 1 diabetes mellitus. So, family history of type 1 diabetes mellitus will increase the risk of a relative developing it by 10 times. Definitely, family history. If family history is present, then you are at risk of developing autoimmune disease, which destroys your own pancreas as well. A child's risk of inheriting type 1 diabetes mellitus from their affected parents can vary between 1% and 9%, so it is not that much. Family history of other autoimmune diseases such as hypothyroidism, pernicious anemia, celiac disease will increase the risk of type 1 diabetes mellitus as well. If you have other autoimmune diseases, you may develop type 1 diabetes mellitus due to autoimmune restriction of your pancreas as well. Breastfeeding is possibly associated with a lower risk of the infant developing type 1 diabetes. Early introduction of cow's milk to an infant's diet is possibly associated with a high risk of developing type 1 diabetes. Early introduction of cereals prior to 3 months of age is also possibly associated with a high risk of developing type 1 diabetes mellitus. Regular doses of vitamin D early in life have been shown to decrease the risk of developing type 1 diabetes mellitus. So basically, obesity, poorly diverse gut microbiome, your poor diet, your early introduction of cow milk in your during your infancy, family history of other autoimmune diseases also increases the risk. Lack of vitamin D exposure in your early childhood also increases the risk of type 1 diabetes mellitus. Then there is pathophysiology of type 2 diabetes mellitus. How does type 2 diabetes mellitus occur? So type 2 diabetes mellitus is a metabolic disorder in which the body's response to insulin is reduced, also called insulin resistance. So it's not the deficiency of insulin. Production is initially increased by the pancreas beta cells to try to counteract the insulin resistance. However, over time, there is a progressive decrease in insulin production and secretion leading to insufficient insulin levels. The combination of insulin resistance and impaired insulin secretion results in hyperglycemia and type 2 diabetes mellitus. Type 2 diabetes mellitus is more common than type 1 diabetes, making up 90% of diabetes diagnosis. So basically what happens is insulin receptors on cell surfaces become resistant to insulin. So insulin receptors do not respond to insulin. When these receptors in the bodies of any obese individual stop responding to insulin, what happens in the step 2, there is a compensatory increase in insulin production and secretion, so the beta cells go into overdrive. They go into a restless stage of producing more and more insulin, so that in a futile exercise, so that the body responds. But the person is obese, person is having metabolic syndrome, person is not doing any physical activity, person eats junk all the time, person is a stressed person, and the patient is a depressed person, and his body has stopped responding to insulin. So 1 year, 2 year, 3 years, then what happens? Beta cells start to fatigue, and when these beta cells start to fatigue, this leads to accelerated beta cell changes, damage, and decreased insulin secretion. And then we can go to the step 4. The insulin resistance and inadequate insulin secretion leads to type 2 diabetes mellitus. There is increased insulin resistance, decreased insulin secretion, and the result is increased levels of glucose in the body of that patient. So he's he has become a diabetic now. Risk factor for type 2 diabetes mellitus. There are two types of risk factors. One are modifiable and other are non-modifiable. So the genetic inheritance of type 2 diabetes mellitus is very strong, especially when compared to type 1 diabetes mellitus. Yeah. So the genetic inheritance of type 2 diabetes mellitus is very strong. That is why if you have family history of type 2 diabetes mellitus, you have to be extremely careful in your lifestyle choices. A child who has one parent with type 2 diabetes mellitus will have a 40% chance of developing it. Yeah, I also have the 40% chance of developing diabetes mellitus because my grandmother had diabetes, my father had diabetes, and now if I make poor lifestyle choices, I will eventually develop diabetes mellitus, type 2 diabetes mellitus as well. So the pre-diabetes higher than normal blood glucose sugar level, but not enough to be considered type 2 diabetes is also a problem. So what are the risk factors? Modifiable risk factors which we can modify are obesity, overweight, being overweight, low physical activity, as we all are doing less physical activities in this modern generation, unbalanced diet, uh, if we are suffering from pre-diabetes, and then non-modifiable factors are family history of diabetes, older than 40 years old. Yeah, if we go into later ages, we are prone to develop diabetes mellitus. South Asian, African, and Hispanic ethnicity, these people are more prone to develop type 2 diabetes mellitus. If we had low birth weight at our birth, that is also a risk factor. Previous pregnancy with gestational diabetes mellitus in a female, then she's prone to develop diabetes. History of polycystic ovarian syndrome or other metabolic diseases. If there is any other metabolic disease, then he or she is prone to develop type 2 diabetes mellitus. Signs and symptoms of diabetes mellitus are straightforward. If we have excessive thirst, if we have weight loss, if we have frequent urination, if we have slow healing of wounds, yeah, diabetic patients have very slow healing of wounds. You keep waiting for the wound to heal, but the wound does not heal. And this is a very high risk kind of situation. And you need to look into it whenever you encounter such situation. There is excessive hunger due to your cells being hungry for glucose all the time, and they are not getting glucose despite glucose levels being high in the blood. Then you are fatigued all the time, you have blurred vision, you have numbness in your body. So most common symptoms are basically polyuria, which is increased urine output. You are losing glucose through your urine, and that glucose also draws in water along with it. So whenever you are losing glucose in the urine, the water gets lost as well due to osmotic effect, due to the diuretic effect of glucose. So there is a symptom called polyuria. So the patient complains that he has to get up 4 or 5 times at night just to pee, and this was not the case previously. Then there is increased urinary frequency during the day as well. Patient complains that he or she has to go to the washroom 10 times a day or 12 times a day, which was not the case previously. Then there is polydipsia as well. Patient says that he or she has insatiable thirst. He or she keeps drinking water, but the thirst does not go away. In polyphagia, patient says that he or she is always hungry, which was not the case previously. Unexplained weight loss. Yeah, the person goes into catabolic state if not treated. So patient is eating a lot, patient is drinking a lot, patient is urinating a lot, but at the same time patient is losing weight as well, and there is blurred vision as well. His or her eyes also get affected. Then the patient also says he gets fatigue. There are recurrent urinary tract infections. There are recurrent skin infections, recurrent fungal infections, recurrent darkening of the skins around the neck, groin, axilla, or armpits, and the patient goes to the dermatologist or aesthetic beautician that what to do with this. There are the sensations of paresthesias, numbness, burning, pickling, or tickling sensation, typically in the extremities, that is hands and feet. Slow healings of cursor sores. So all of these are the signs of diabetes mellitus. So if a person is suffering from these changes in his body, these changes in these symptoms, he or she has developed diabetes mellitus. So what will be the clinical presentation of diabetic patient? So symptoms of hyperglycemia will be present. Patient will come to you and say, I am having polyuria. He will not say he's having polyuria, polydipsia, polyphagia. He will use the layman terms that he has to urinate a lot, he has to eat a lot, he has to drink a lot. But these are the terms which you will understand that now the patient is suffering from polyuria, polydipsia, polyphagia. Then plasma glucose concentration, you will ask your nurse, or you will ask the paramedic alongside you, or you will do it yourself. You will get the plasma glucose concentration of that person checked, and that plasma glucose concentration will come around 200 milligram per deciliter 2 hours after a 75 gram oral glucose load. That is called OGTT, oral glucose tolerance test. Fasting plasma glucose level concentrations of more than or around 126 milligram per deciliter after at least 8 hours of fasting is also an indication of diabetes mellitus. And random blood glucose concentration of more than 200 milligram per deciliter at two separate occasions is also diagnostic, and HbA1c levels of more than 6.5% is also diagnostic for diabetes mellitus. So, what are the prevention strategies for diabetes mellitus? So, prevention strategies are maintaining a healthy weight, eating a healthy diet, being physically active, quitting smoking, reducing sedentary behaviors, as we all are passing sedentary lifestyle these days, almost all of us, reducing stress in your life, and getting support from the people around you. So you have to lose weight if you have become pre-diabetic or if you have become diabetic. There is no other way to lose weight than maintaining a healthy lifestyle. Eating a healthy diet. Eat smaller portions, limit red meat and processed meats, and eat a variety of food from each food group. We will discuss what foods to eat and what foods not to eat later. Then the person has to be physically active. Aim for at least 150 minutes of moderate to vigorous exercise each week. So basically, the person has to do at least 150 minutes of moderate to vigorous exercise each week. This can include aerobic exercises like walking, swimming, biking, or running, and resistance exercises like weightlifting, yoga, or calisthenics. Then quitting smoking. Smoking has been linked to type 2 diabetes mellitus as well. Reducing sedentary behaviors means limit prolonged TV watching, and these days limit scrolling on the Android phones as well. As we keep scrolling on the Android phones, the TV problem was not that much of a problem, but this modern problem of smartphone use is has become even more severe, and we keep scrolling and we keep being inactive, and we become glued to our smartphone screens, and this creates a long period of inactivity in our body. Reducing stress. Try stress reduction methods like yoga or meditation, getting sports, speak to your doctor, or find a weight management group in your area. So, prevention strategies of diabetes mellitus, how to prevent diabetes mellitus. So, first of all, you have to understand diabetes mellitus. So, basically, prevention strategies are for type 2 diabetes mellitus because type 2 diabetes mellitus has many modifiable risk factors which can be modified, and that is why the disease can be stopped from progressing. Know how type 2 diabetes mellitus can be prevented. There are changes you can make to your lifestyle that can help you prevent type 2 diabetes mellitus. Understanding type 2 diabetes mellitus is learn how diabetes can affect your body is an important first step to preventing it. Learn what risk factors you have. Even if you are high risk, you can prevent or delay type 2 diabetes mellitus from developing. So if there is a high chance of high incidence of type 2 diabetes mellitus, like your father and your mother, if they both suffered from diabetes mellitus, type 2 diabetes mellitus, there is more than 60% chance that you will develop the disease in your lifetime. And you know that you will develop type 2 diabetes mellitus at some point in your life, but you can delay that point from becoming at an early age. For example, if you spend a very casual and very carefree life, you may develop type 2 diabetes mellitus by the age of 35 or 40 years. And if you are extremely careful about your lifestyle choices, then you may delay the onset of disease by even 15 to 20 years. So, if you become careful in your lifestyle choices, you may delay the onset of diabetes mellitus by at least 20 years, so that you do not start having the full blown symptoms of diabetes mellitus by the 55 years of your age. That is reality. You can delay the progression of a disease, you can delay the onset of that disease, even if you are prone, even if you are extremely prone to develop type 2 diabetes mellitus. Like in my case, my mother is a diabetic, my father also suffered from diabetes mellitus. So I am a high risk person for developing type 2 diabetes mellitus, but having healthy lifestyle choices can prevent the development of type 2 diabetes mellitus in me by 10 or 15 years, can delay the development of type 2 diabetes mellitus by 10, 15, or even 20 years. So this is in my hand, that how I um, past my life, how I control the urges to eat sugar, to do this, to do that. So this controls a lot. This defines a lot of how my disease progresses. Making healthy food choices, as we already discussed in our previous lecture series of nutritional health. So, manage portion sizes, read food labels. Always read food labels. You do not eat everything without reading food labels from supermarkets. There are many things which are not sugary in taste, but they contain a lot of carbohydrates, which increase your carbohydrate levels, which is basically glucose levels in your body. Choose healthy fats over unhealthy fats. Knowing the different types of fats and the foods they are in can help you know what foods to eat. Balanced carbs. Choose less processed carbs that have vitamins, minerals, and fiber along with energy. So basically, you use organic things more and processed foods less. So basically, you have to cut back the fast foods. You have to cut back the processed flour. You have to cut back all the things related with the bakery products. So all of these are basically extremely processed foods, so you have to cut back all kinds of processed carbohydrates. You can use whole flour. You can use organic sources of carbohydrates because they are much less damaging than processed foods. Try the traffic light method. Dividing foods into categories is a great way to track healthy choices for meals and snacks. Yeah, you would say that this is a red line for me. I cannot eat juice. I cannot eat this processed food. I cannot drink juices. I cannot take sugary tea. I cannot take this cake or this pastry. These are red lights for me. And then you can say these are yellow lights for me. These are yellow signals for me. I can eat this kind of food, but not more than once a week, something like that. Eat out smarter. Practice making healthy food choices when you eat out can help you get on the road to better health and become physically active. We have already discussed how you can become physically active. You can do cycling, you can do jogging, you can do anything which makes your heart pump more blood and which makes you sweat. So basically you have to become physically active at all costs if you want your disease to become later in your life or do not come at all. The nutritional guide for high risk or individual diabetes patients. So there are many nutritional guides there, but I usually go for the Center of Nutrition Policy and Promotion, the CNPP, which is basically an American organization. So they are the most authentic one. So you have to eat 2 cups of fruits, 2.5 cups of vegetables, then 6 ounces of grains, 3 cups of dairy, and 5.5 ounces of proteins daily. So basically, you have the 2000 calorie plan. The 2000 calorie plan basically is a average plan which keeps you healthy. So you do not take extra calories and you do not take less calories. You stay in between the 2000 calorie plan, which is an average plan. Yeah, if you are working out harder, if you are doing excessive exercises, if you are physically fit, then you can increase your diet plans as well. But these are basically the food choices, and they have written the word grains. They haven't written the word carbohydrates. So basically you have to use whole grain versions of common foods. You have to use whole grain breads, whole wheat flour things like whole wheat flour pasta, whole wheat flour breads, whole wheat flour tortillas. You cannot use processed white flour because they get all the fiber out of the whole flour and then sell you processed flour, that is white flour, super fine flour, at much higher prices, and they then resell the fibrous substances extracted out of the whole flour as an extras. So basically you have to eat organic foods, organic whole grain versions of common foods. That is why they use the word grains and not carbohydrates. So, what is diagnosis of type 2 diabetes mellitus? I think we are getting short of time, so I will wind it up. So, diagnosis of type 2 diabetes mellitus is pretty simple. Visit your doctor as soon as you suspect that you may have diabetes. They will perform any one of the following tests to diagnose your condition. So, first of all, they will check your fasting glucose test. If you reach your GP clinic and you're fasting, they will go for your fasting blood glucose levels. So your blood sample will be taken after an overnight fast. This test measures your blood sugar levels. A level of 126 milligram per deciliter or 6.9 millimole per liter or higher indicates that you have diabetes. Then there is HbA1c test. I cannot go into the details of what is HbA1c, but to keep things simple, it is basically glycation of our hemoglobin present on our RBCs, red blood cells. So it gives an 3 month. It gives us a 3 months average of HbA1c levels. So basically, 3 months record of how our body glucose levels were detected with this test. So a blood test measures your average blood sugar levels for the last 2 to 3 months. And A1C level of 6% or higher indicates that you have diabetes. So, oral glucose tolerance test. For this test, you will be asked to drink a sugary liquid, and then your blood glucose levels checked every 30 to 60 minutes for up to 33 hours. You may have diabetes if your blood glucose levels is 200 milligram per deciliter or higher at 2 hours of taking a 75-gram glucose drink. So you are loaded with a 75-gram glucose containing sugary fluid, and then at 2 hours after taking that fluid, your blood glucose levels are checked. And if the blood glucose levels come back more than 200 milligram per deciliter, then you are labeled to be diabetic. So, what is the normal HbA1c level? It is less than 5.7%. So, fasting blood sugar should always come less than 100 milligram per deciliter. And pre-diabetic patients have HbA1c ranging between 5.7 and 6.4. And fasting blood sugar test comes between 100 and 125 milligram per deciliter, and you have to label some person to be diabetic. Then their HbA1c levels should be more than 6.5%, and their fasting blood sugar levels should be 125 milligram per deciliter, and their random blood sugar levels should be more than 200 milligram per deciliter to label them as diabetic. So, what are the treatment options? I will briefly go through. The treatment of type 1 diabetes mellitus is basically insulin. As we already discussed, type 1 diabetes mellitus is insulin deficiency. The beta cells of pancreas are not producing insulin, so you need insulin from outside to be entered into your body. So insulin therapy is the main treatment for type 1 diabetes mellitus. This makes sense as the pancreas is unable to produce insulin. There are different types of insulin that can be administered, and they vary on their onset, peak, and duration. Onset is how quickly insulin lowers your blood sugar. Peak is when insulin is at maximum strength. Duration is how long insulin works to lower your blood sugar levels. So these are the basic things which your endocrinologist or your internal medicine guy will discuss with you, that what kind of insulin is better suited for your disease. So if you need a regular or short acting insulin, they will prescribe you with a short acting insulin, but they will guide you with the better option, that how to control your blood sugar levels optimally depending upon your lifestyle and your ease or your comfort levels. The main types of insulins are rapid acting insulins, insulin aspart or insulin lispro, then short acting insulin, which is regular human insulin, intermediate acting insulin, which is isophane insulin or NPH, long acting insulin, which is Detimer or Glargine, then ultra long acting insulin, which is Glargine U300. Pre-mixed insulin is also available, which combines intermediate and short acting insulins. So these are basically, this table defines what type of insulin should be used in a person. Now, what kind of action do we need? Rapid acting, short acting, intermediate acting, long acting, with their onset, their peaks, and their durations. You people can see this table later on. Then, treatment of type 2 diabetes mellitus. The management of type 2 diabetes involves the input from a multidisciplinary team. Due to the potential complication of diabetes, the patient will be seen by a variety of specialists, including general practitioners, ophthalmologists, diabetic nurses, assistants, podiatrists. Podiatrists are basically foot care persons who specialize at the foot cares of a diseased person, and dietitians. Yeah, dietitians have a role to play in the management of type 2 diabetes mellitus. The treatment and management of type 2 diabetes mellitus involves the following: education and lifestyle changes, as we already discussed, diet and exercise, then medications, which are basically oral diabetes medications and insulin as well, and careful glucose monitoring. Yeah, the patient needs to monitor their glucose carefully. So the type 2 diabetes mellitus treatment is a multidisciplinary approach, multi-pronged approach. You have to have balanced diet, you need to do exercises, and then there are medications. You need to start taking medications orally, and if the oral medications fail, then you may be shifted to the insulin as well for some period of time, and when your body stabilizes, you can be reshifted to the oral glucose lowering drugs such as metformin, glipizide, pioglitazone. I cannot go into the details of these medications because this will start another class of pharmacology here. So basically, there are many medications, but the first line medication you always remember is metformin. You always start the treatment of type 2 diabetes mellitus with the balanced diet, lifestyle modification, and then metformin. You always start with metformin until and unless metformin is contraindicated to be used in a patient. There are some indications when metformin cannot be given, then you can skip metformin and you can go to the second or third line medications. But if there are no contraindications, always start with balanced diet and exercise with weight loss regimens and metformin. Then glucose monitoring is extremely important. You every 2 to 3 months you advise the patient to come to your clinic and their HbA1c test should be done, and finger stick glucose testing should be done daily or multiple times per day depending upon the treatment plan and depending upon the compliance of the patient. Then the target HbA1c goals of type 2 diabetes mellitus. This is our last slide. So basically, if a person HbA1c becomes 6.5% when he or she presents to you, so he is a borderline case. You do not directly label that person to be diabetic. You may label that person to be diabetic, but you may not start the person's oral medications. You only advise them to change their lifestyle and come back later. They stop eating all kinds of junk. They stop eating all kind of sugary substances. They stop being inactive all the time. They start physical activity. They start being active. They start behaving like a kid. They stop behaving like a kid. They stop eating junk. They stop eating sugary substances. They stop eating any kind of processed foods. Then the patient is advised to come back later, at least 1.5 to 2 months, and you run the tests again. And HbA1c level, if the HbA1c levels falls below the 6.5% target, then the patient is saved from oral medications. But if a person's HbA1c is more than 6.5% and less than 7%, you start with metformin. And if it does not come below 7%, then you have to go to the dual therapy. That is, second line drugs are used, and sometimes two second line drugs are also used with metformin. But if the HbA1c does not come below 7% despite all of the drug therapies, then you have may be when then the patient may be shifted to insulin as well, and the person's aggressive lifestyle changes are needed because the diabetic complications are on their way within a year or two if you do not control the blood sugar levels in the long run. Have a nice